I hope you remember the two videos we saw. That was bad communication or bad consultation and good consultation. In one, the doctor wasn't very well behaved, although both the doctors are extremely, extremely nice doctors, and they're actually my teachers. They're the one from whom I learned clinical communication training, but they have done a wonderful job in that video. So if I may ask you, what do you remember from both the videos and what was your takeaway? It's better if you write in the chat box, because I know if I ask you to answer, you will start answering and then we may have to cut short. So you can write in the answer in the chat box. What has been your takeaway from the two videos that we saw in the last session? Yeah. Okay, response manner was not okay. Fine. Okay, even the listening manner you did not find okay, accepted. What else? Okay, lack of empathy. You could sense that there was no empathy. And then motivation to the patient, he was not motivating, rather he was criticizing. Body language was not appropriate. Arti, I agree with you. That was probably very rude and aggressive and intimidating. Absolutely right. Lack of proper protocol. Yeah, I think probably he was acting the way he would behave in any situation. So he didn't have any professional approach. Okay. Privacy about the treatment of other patients. Yes. Eye contact was missing from the beginning. Yes, I agree. I think that was very obvious when he was not even looking at the person who was coming in. He was judgmental. I think that's a very important point. Yes, when you say that you are good for nothing, you're not looking after yourself, you're not taking treatment properly, so you're being judgmental. How do you know what challenges the patient is going through? Intention should reflect in the body language. Yes, I agree. And a lot of blaming and shaming took place. Veera, I agree with you. And then dismissal of patient's concern. Yes, actually, he did not even check for patient's concern. He was critical about his behavior and his, not being compliant. Absolutely, I agree with you. I think wonderful. These points are really very well taken. And then my next question to all of you is, what essential skills besides we talked in the session you think are very, very essential, and you feel that you will make sure that when you interact with your patients or your fellow professionals, you will keep in mind? So, I mean, it could be from the list that we discussed, or it could be anything that you think is very, very essential when you're interacting with your patients or with your team members. I consider both as our stakeholders, so we need to really, yeah, politeness, greeting, absolutely, clarity about the message. Yes, I agree with you. So that's really very important. And then validating the patient's experience and then providing any information. Yes, absolutely, that's correct. Greet the patient, maintain eye contact, listen carefully, and have empathy. For me, I completely agree. To be empathetic, I think empathy is one skill I feel. I mean, you can't do without that. In healthcare, you can't work without it. And I think that's the weakest point, because my next question is about empathy. Yes, empathy and respect are very important. Friendly approach and openness, yes. Uh, and then active listening and open communication. That's very important. We need to make the other person comfortable so that they can speak and share their concern. Absolutely. And then to greet them with smile, uh, and then allow the patient to have their room to speak. Absolutely. I think, again, making them comfortable, making them feel respected, wanted, considered as equal partner in the discussion. That's very, very important. Being non-judgmental. Absolutely. And there's a difference between being friends and being friendly. The later is better. Yes, I think that's another good point you have picked up. Patience to listen what the patient says. Absolutely. That's absolutely right. Wonderful. So I think very basic things, nothing very big or rocket science that we cannot practice. But if we remember that we have to, express or demonstrate that I'm happy to help you, I'm there to serve you, I'm there to attend to your need, I think that would make a huge difference in the way patient will feel wanted and accepted and respected by us. We all know these skills. I think this is nothing new. We all know what required, but the problem is, do we offer this to the patient? That's a question to be asked to oneself. Uh, I mean, deliberately somewhere either we avoid or we don't care or we assume that patient doesn't deserve all this, so we kind of cut short all those things and we straight away go to the care part, which at times becomes very insensitive and blunt in nature. So my third and the last question to all of you is, many of you said empathy is very important, and that's one of the skill. And I personally also feel empathy is a very, very important skill in all human interactions. It's not just with patients. I think with our fellow professionals, with our teammates, with our people who are working with us, empathy is one skill which will actually take you places. But a lot of us are not very empathetic. My next question to you is, what are the barriers to expressing empathy, especially in healthcare? What do you think are the barriers in expressing empathy? Lack of skills. Wow, I think I agree. That's one. And it's not just lack of skills, Srida, it's also lack of understanding. And I'll explain you once everybody answers. I will talk about it, why I say it is even lack of understanding. But you are very right. It needs to be learned. Some people are born with this skill, but all of us otherwise can learn how to express empathy, how to experience empathy. Excitement about the treatment in patients to attenders. Uh, Mr. Kumar, I think I will ask you to explain this once everybody has answered. So I would want you to explain this, what exactly you mean. Lack of adequate time to bond with the patient. Dr. Deepa, I want to tell about this, but after everybody has finished, I think it's a wonderful answer you have given, but I want to touch upon this. Then hijacking the conversation by making the conversation about yourself and not the other person. That's also. But Suvira, with patients, I think we don't talk about personal things, but we somehow skip the empathy part. Like Dr. Deepa said, time, or you said lack of training. Yes, cultural difference, I agree, Dr. Kausar, but at the same time, I think empathy runs in all races, all ethics, all, countries, all cultures. So honestly, I think empathy is one thing that, of course, expression can be different. I completely agree. In certain places, we touch the person and we hold the shoulder or touch the head of the person and express empathy. In certain cultures, that's not appreciated. That I completely agree. But then there are so many ways to express empathy, even non-verbally and non-physically, which can do wonderful. Aparna, workload and time mismanagement. Again, you have brought up a very valid point, but I want to just talk about that. And then being apathetic and sympathetic instead of empathetic. Yes, I think that's the truth. A false belief that displaying feelings is weakness. I think Dr. Purnima, you have nailed the issue that I wanted to bring in. Lot of, and especially when I'm working with the medical graduates, a lot of them say that our seniors say, don't attach yourself with the patient. And they assume empathy is attaching with the patient, which is such a big misnomer. Empathy is not attaching, it's a cognitive process. You're not emotionally attaching with the patient. It's in the moment, you are understanding what my person is going through or my patient is going through. And at the same time, the next second, you are thinking, what can I do to relieve this person's suffering? That's all. You're not carrying that burden with you. So, as I said, a lot of us do not have clarity on what exactly empathy means. And we think it's emotionally attaching. And that's where probably people hesitate expressing empathy. That if I express empathy, people will consider me either weak or there's a risk I will get attached to the patient. And then there will be transference and counter transference, which is, of course, never desirable in a therapeutic arrangement. So we say, okay, let's not talk about emotions at all, and we just put a lid over it, which is where sometimes patients view us as insensitive, lack of empathy, or even apathetic, which is actually not always true. But then that's the interpretation people have about our behavior. That's one point I wanted to clarify. Some of you said lack of time and burden. Again, let me tell you, empathy does not require time, nor it requires any, extra effort on our end. Empathy is an attitude, let me tell you. It becomes part and parcel of your persona when you start practicing empathy in your communication, in your behavior, in your body language, in your gesture, posture, everything. It doesn't require time. Rather, I'm reminding all of you, the moment you will start practicing, it actually unburdens you. It actually adds fuel to your body and to your mind because it releases couple of hormones which improve our sense of well-being, and your work becomes joy. You don't get tired of working. You start enjoying your work because you're constantly getting that energy which is required for you to be on toes. So today is Doctor's Day, and I think I should have started my session by, wishing all of you and greeting all of you and saying that Happy Doctor's Day. And today on my LinkedIn post, I talked about one of the doctors who's a very good friend of my husband, but at the same time, he's a good friend to me and my brother. So Dr. Praveer Bhatia, I don't know many of you may be knowing him. He's a bariatric surgeon practicing in Delhi. He's a chairman at the Sir Gangaram Hospital for the bariatric surgeries. Plus, he holds his own hospital where he practices as a surgeon. So he's one person. Whenever I meet him, I really wonder from where does he get that energy. He's always, you know, overflowing with energy, and the kind of work he is doing is not nothing very simple or nothing very non-challenging. But you meet him and you see and you feel, oh my goodness, where does he get this energy? The reason I feel, the energy is he enjoys his work. He's happy doing what he does. So same like when people ask me when I do full day programs standing in a hospital from 9 to 4 or 9 to 5, people ask me how come you are able to run same amount of energy level even till the end of the session. I think the only one reason what I can see in myself is probably I enjoy my work the most. And that's the reason I don't feel tired even at the end of the day. Physically, maybe, yes, there are times where you feel, yeah, you're feeling tired in your feet or you're tired in your legs, but then somewhere at the energy level, you don't feel any less than. So empathy is one, skill which if you, embed with your general interaction, you will see it doing wonders. And people would love to work with you because when you are able to understand their pain, their suffering, their conditions, their circumstances, they're always grateful to you that, oh my goodness, you see how difficult things are at my time. So that's about the previous session. Any questions about till what we have discussed till now? I can see some more answers also in the chat box. Yeah. Image display, yes, images that I should not express empathy. That also is one thing. And the conventional belief that the doctor should operate cerebrally and not emotionally. Agreed. But I always say empathy. And if you will read about empathy, it's a cognitive process. It is not an affective process. So I think you will get to see. And Suvira has written Munna by MBS, the role played by Boman Irani is about the not showing empathy as it makes you weak. Yes, I think you're right. So he kind of played that role where he's not empathetic. And he did justice to the task he was given. Okay, so that was about recap. I think we are back to the topic that we discussed last time. Now the part that was left and the fifth skill that we had to still cover, and that is assertive communication. This is one skill I think it's very, very empowering personally and professionally. I learned it with a lot of effort. I practice it a lot and I enjoy when I practice it because in a lot of difficult situations, you need to speak, you need to say, but a lot of us feel if I say anything, people will, feel bad or they will not like me, they will disapprove me. So honestly, if I explain what assertive communication is, or rather what different styles of communications are, see, in public dealing, in healthcare, in teamwork, there will be number of situations where there will be disagreement on something. For example, you are recommending surgery to a patient and the patient is not agreeing for it, although it is all in the patient's interest, but patient is not just accepting it. Or for example, you are recommending something but the other person is just not accepting. We have seen patients and family members going lama, or maybe fighting or arguing over bill, or admission or procedure, diet. So these are common issues that you must be seeing in your workplace. So these situations are very, very common, but we all handle these situations in four different ways. I'll take an example of, for example, you're in ICU and there's a patient who is VIP and has a lot of visitors. So normally in ICU, we don't encourage visitors coming in, and they should only come during the visiting hours if at all they need to come. But because this patient is VIP and is well known to everyone, so his attendants or his family members are just walking in and out of the ICU without any hesitation. Now, some of us might just ignore it, may not even react to it. So that style of communication where you don't voice your concern, where you don't speak out, that's a passive communication. So I hope you remember you have taken a questionnaire. Do you all remember? And do you all have your scores with you? Do you have your scores with you? Anybody who does not have their score? Have you kept your scores with you? Raise your hand if you have. Uh, Vimalji, you don't have the scores? No, you have not kept it. Okay. So let me bring up that. Give me 1 second. So I'm going to show you your scores. I had actually hidden everybody's name because I didn't want to, discuss the scores with your name. But it's important for you to know your scores. So I'm going to share with your name now. Give me a second to share the screen with all of you.
Yes, ma'am. Yes, ma'am.
Yes, Mr. Vimal, you want to say something?
No, I just wanted to see the score.
Yeah. I'm trying to get in that Excel sheet. Okay. So there we are. So I have, these are your total 4 scores after calculating everything. So if you look at the screen, are you able to see your scores?
Yes, ma'am. Vimal
Okay.
M.
Okay. So yeah.
19.
So the first, okay, hold on. If you want, you can note down with for you. You can note down the first 4 scores. Like for example, in front of Dr. Jacob's score, 12, 9, 14, 17. You can quickly note down your scores.
Yes, ma'am. Mine is 7, 6, 6.
Dr. Vimal, Mr. Vimal, don't speak. Let everybody note down quietly.
Oh, I'm sorry. I'm sorry.
Has everybody done? So if you have noted down, write in the chat box your scores. Please write your scores in the chat box. And can I stop sharing? Please write your scores in the chat box with a comma in between. You can write for, yeah.
Yes, ma'am.
Like our, yeah. Yeah. Okay. So we all handle such situations where there could be a conflict or disagreement or that requires negotiation or discussion. We handle these situations in 4 different ways. One is that we don't speak up, we don't take any stand, we don't voice our opinion. Like I said, in the ICU, for example, if there's a patient's attendant who are walking in and out, you don't say anything, you just quietly observe and you become quiet. That style of communication is called passive communication. Your first score is your passive communication style score. So you can write in front of your first score for you that's your so Vimalji, your last score is 19. You have written 3 scores, but your yeah, please write once again. Okay. So, but more than being quiet, a lot of time we don't speak up because probably we want to avoid conflict. We don't want to confront the other person. We don't want to get into any argument. But internally, we are unhappy and dissatisfied, and therefore we try to find a way to somehow equate the scores. Maybe we would talk bitterly about that person, or we will try to talk to other people in a negative way. For example, if I'm in ICU and I see patient's attendant coming in, I don't say anything to the patient attendant, but then I talk to my fellow professionals and I tell them, oh my goodness, what do they think of themselves? Do they think their boss is here and they don't respect ICU? Do they realize there are so many patients who are unwell and they can't be, but who cares for, other patients? So what I'm doing, I'm cribbing. I'm just talking negative, but I'm not addressing the issue with the correct person. That style of communication is called passive aggressive communication. So your second score is your passive aggressive communication style score.
Ma'am, I just wanted to interfere. My score is 766. That's all. The last one is
and 90. No, yeah, that's all. Yeah. We will talk about that in a minute.
7.
Let me explain.
Yeah.
Yeah. Okay. So the third style of communication is where you become, you are not only unhappy, but you actually, it comes out in your behavior. So maybe your facial expressions will change. Your tone of voice can become, rude and aggressive, or you may start shouting, or you may look at the person in a very aggressive way. Your language also can go, wrong. That style of communication is called aggressive communication. So your third scores are your aggressive communication style score. So for example, if I'm in the ICU and the patient attendants are coming in and out, I may start saying, what do you think of yourself, man? This is an ICU. This is not a mall or a walking space that you're coming in and going out like this. You need to understand there are other patients. That's not the way to, So what I'm doing, I'm being aggressive with the patient part. I'm shouting at them, or I'm kind of misbehaving with them. That style is called aggressive communication style. Whereas the fourth style, which is assertive communication, is the style where you address the issue in an open, honest, respectful, positive, and confident way. 5 elements: open, honest, positive, respectful, confident. So if I see their attendants coming in, patient's attendant coming in and going out, I call the patient's primary caretaker, maybe the patient's daughter or son, and I ask them, see, I can see you have a lot of attendants coming in and going out, but please remember, this is ICU. Your patient, when they're put in the ICU, that means your patient requires attention from the medical team. And at that point of time, the family will have to take a back seat and they should be, we should rather be advised to stay out. It's only the immediate family member who need to see the welfare of the patient. They should be coming in. So I request you to not let anybody and everybody come in. And if you have any question, you can come and talk to me, but let's not disturb the patient. And there are other patients also. And there's a risk of infection to your patient, to other patients, and to you also. So I would suggest that please ask all your attendants either not to come, or if they need to come, then let them come during visiting hours. But if you have any concern about the patient's welfare or well-being, you can always come and talk to me. So what I'm doing, I'm expressing in a very open and honest manner, but at the same time, I'm respectful, I'm positive, and I'm calm. And that's one skill which is very, very essential, in public dealing. Most of the situations can be handled very, very effectively if we all learn how to assert. It's a difficult skill. It comes with time, but more you will practice, more confident you will become of, using it in any and every situation. Actually, most of the aggressive situations can be, de-escalated or mitigated just by being assertive. The other person might act aggressive, but you not being aggressive will automatically calm them down, because human mind works on the concept of mirroring. If an aggression fuels aggression, if they are aggressive, you are aggressive, there's all the possibility of having an aggressive reaction coming up and then escalating the issue. But if the other party is aggressive, but you are assertive, you will see the other person slowly calming down and coming down to your level. So I really love to talk about that movie. I think I talked about last time also, Karate Kid. Did I talk about that last time? No. So because I'm taking sessions, so I forget where I've discussed this, but I love bringing that, example. How many of you have seen that movie Karate Kid? Some of you have seen it. So in Karate Kid, there's a young kid whose mother actually puts him under a training of a trainer for karate. He's a young kid, 12, 13 years old, not very old. Probably he was being bullied by his classmates. So his mother thought that my son should undergo some training and become more confident in dealing those situations. So this kid is under the training of this karate master, who's an excellent trainer. He takes this boy to a monastery to show him another place or what it was. So there he sees a girl and the snake. They are doing the same movement. The girl is actually making the movement that the snake is making, like this, like the way the snake moves. So he asks his teacher, he says, why is this girl copying this snake? And the teacher says, the girl is not copying the snake. It is the snake that is copying the girl. So if you stick to your behavior, you can make anybody copy your behavior. The thing is, we lose patience. We assert, but when assertion does not work, we go back to our default mode of handling conflicts. And you know what is that? Your second highest score is your default mode of handling conflicts. If you look at your second highest score, so I can see most of you have a highest score on assertive communication, most of you. So that means you start with assertion, you try assertion, but if assertion does not get you the result you want, then you're likely to move on to the second highest score. So I'm taking a couple of examples. So Dr. Jacob, your name comes first. So I'm taking your example. So your highest score is 70. That means you start with assertion, but if it does not work, there's a possibility that you can move to the next highest, and that is aggression. Do you agree with your scores?
Yeah, I do agree. That's right, ma'am.
Thank you.
Yeah.
You. 'Thank 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 you. I'm taking another example, that is, Dr. Malik is not here, so we'll not discuss his scores. Manjusha is not there. A couple of doctors are not here because they said that today's Doctors' Day celebration in their, hospital, so they were not in position to attend. So, Aarti, in your case, your highest score is passive communication. So, more than assertion, you are using passive communication in your regular communication. Do you agree with your scores?
Yes, ma'am, definitely.
Okay, if I look at Poonam's score, Poonam, you have highest score on two, styles. One is assertion, and the other one is passive. So there's a possibility you assert, and in certain situation you just become assertive, passive, because you choose to be passive. So if you don't agree with your scores, please take this questionnaire once again. Probably there is some this thing, or I mean, maybe there are certain situations where you prefer to be quiet and not take any stand. But you can confirm your score. Now, any other score? Okay, Dr. Purnima, your highest score is 19, which is on aggression. So that means aggression is your primary way of handling things. And you use assertion, but more than that, probably you are using aggression in your approach. Do you agree with your scores? Yes.
I agree with the scores, and I know that it requires a lot of effort to stay in the modified method and only to keep up the official way of dealing. I understand and agree, ma'am.
Yeah. A lot of time when we are in a administrative position, so we are so used to this as our way of handling situations that we assume that aggression is the right approach in managing people and situations. Whereas with time, we have realized, especially with Generation Z, this style is just not working. And that's why a lot of time people have challenge working with the new generation because they just don't take aggression. They would collide with you head on and they will start arguing with you and answering you back. So, I mean, if you have this as a way of handling situation, you can get into challenge. So anybody who wants me to discuss the score, their score, I'll be happy to talk about that. Anybody who wants me to.
Ma'am, Bindu ma'am.
Yeah. So you want me to discuss your
Yes,
score?
ma'am. Yes, ma'am.
Is it there? Yeah. So
Here I
your
need to
score
improve
is
my things.
14, 11, 13, 18. Am I right?
Yes, ma'am.
Yeah. Yeah. So one is that you start with assertion. Again, if assertion does not work, there is a possibility either you will become aggressive or you will become passive. Again, see what happens if I'm dealing with somebody senior, then probably I'll become passive. If I'm dealing with somebody junior, lower in hierarchy, I'm likely to become aggressive. Because both the scores are quite close, if you see. In your case, 14 and 13 are just neck to neck. So that means you try assertion, and if that does not work, then you're likely to become either passive or aggressive, depending upon with whom you're dealing. Do you agree with your scores?
Yes, ma'am.
Okay. Okay. I think,
Ma'am.
Yes, please. Vimalji, you want me to discuss your score? Okay, I think even Rose has said I will talk about her also. So, Vimalji, I think your scores are very, 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 ideal scores, I will say. Your highest score is 19, which is assertion, and your all other scores are very, within normal range, I would say. So, I think you are managing your situations very well in a very, assertive manner, which is appropriate, which is yeah. So, Rose, in your case, again, 13, 6, 6, 19, that means you use assertion. And if that does not work, then you are likely to become quiet. You don't make an extra effort to go and have a further discussion. You would prefer, closing down and becoming passive. Rose, do you agree with your scores? Okay. Dr. Deepa wants me to discuss her scores, and yeah, 7, 8, 12, 20. So again, Dr. Deepa, your scores, 20 means it's a very good score in terms of assertion. But again, if that does not work, you're likely to become aggressive. Do you agree with your scores? Because these are the answers you have given. It's not me who has created this answer. You have answered, and based on that, you have got these scores. But all in all, what I want to say, that more you will use assertion, more comfortable you will be. So assertion does not get you what you want. Not that if you use assertion, other person will just agree with you. No. But assertion will give you satisfaction that you expressed yourself in an open and honest manner. You have, if you don't agree with something, you can say, see, I can't see the point of view you are trying to show me. Maybe I'm not able to see it, but I'm somehow not agreeing with your point of view. And I think we can agree to disagree. You may have a different approach. I may have a different approach, which is okay. So you're not fighting over that you accept my point of view or I will not accept your point of view. No. In assertion, we express ourselves, then we listen to the other person. We give the other person equal chance to express. And if we agree with the other person's point of view, we agree to even accept their point of view. For example, if I'm having a discussion with any one of you, and I feel what you are saying is making more sense, I would not hesitate saying that I think you are right. I accept your point of view. I'm fine with what you are saying. Let's go with what you are saying. That's the beauty of assertion. So there is no, hesitation taking a U-turn or accepting that, yes, I think what you're saying is making sense. So it's a very, very powerful tool. You can actually handle a lot of situations. You can de-escalate a lot of situations by practicing assertion. And this is one skill I want you to start practicing now. And in the future sessions and the role plays, you will see that's the only skill which will help you to handle any kind of situation. When it comes to, handling complaints or difficult patients, aggressive patient party, or breaking bad news, disclosure of medical error, in all situations, this is one skill that's going to greatly help you. So this is about assertion and assertive skill. So this is the fifth skill, and probably this is the most powerful skill that I recommend to one and all. And the beauty is it will equally help you in your personal life. It's not that it's only for the workplace. Once you start expressing, once you start sharing your thoughts, you feel more confident and comfortable about that. Any question about this skill or in assertive communication? Okay, so if no questions, let's move on to the next topic, and that is, a very interesting topic, that is understanding patients' expectations. So my question to all of you is, the moment you hear this word, patients' expectations, what is the immediate thought that comes to your mind?
Means what?
It's better if we write in the chat box, because I want everybody to, answer. So okay, Suvira says pressure. Yes, I agree. Absolutely. So the moment we say patient's expectation, we feel pressure. Okay. What else? Give time and right diagnosis. Okay. Time, responsibility. I want to be heard properly. Patience. Okay. Time. Mm-hmm. Mm-hmm. Building trust. Mm-hmm. Understanding, quality care. Uh-huh. Diverse needs. Yes. Mm-hmm. Make the patient understand his situation in less treatment. Okay. I want to educate the patients and empower them. Okay. Make the patient understand his situation in less treatment. Yeah, this I've already, mentioned. Any other point? Okay. I should know what I am undergoing. Yes. To be listened, to be heard. Nuanced. Okay. Wonderful. So a lot of time when I talk about patient expectation, asking open-ended question to understand. Okay, yes, Mr. Anand, you are right. So a lot of time, the moment we talk about patient expectation, and especially if that's not something that we have really handled or we like it, we feel, oh my goodness, these patients expect so much from us. What is this? They are in hospital, they are not in hotel. I mean, this if they say the AC is not working or the bathroom is not clean or the mattress is not okay and I'm not comfortable. I want different pillow size. It's too big. It is too small. The sheet is not clean. I mean, those things suddenly, really, boggle us, and we feel that we are overburdened and overwhelmed with these expectations of communication. But I think today's session will give us a deeper understanding of what do patients expect from us. So for that, I want to take you to the case study. I hope all of you got a chance to read the case study that I had mentioned on page number 28 and 29. So what I will do, I will share the screen and uh, show you the case study. And I want uh, some of you to, one by one, I hope I have it, yeah, read it so that everybody, so anybody who is willing to read the first couple of paragraphs. Savira, will you do it? Or anybody? I'm okay, anybody willing to read.
Ma'am, can I?
Sure, go ahead.
Managing patient expectations, case study 1. Ready, set, go. Right
Mr. Vimal, I think you need to switch off your video. Mr. Vimal,
chest and
Mr.
told
Vimal,
his wife Zinab that
Mr. Vimal,
he thought he had a heart attack. Ma'am.
Mr. Vimal, can you hear me?
Yes,
Yeah,
ma'am.
you were not audible. I think there was some network issue. There was some network
No
issue at your
problem.
end.
No
So
issue,
either you
ma'am.
switch
Somebody
off
else
the
can try.
video and read, or let somebody. Sorry.
Somebody else can
It's better if somebody
try,
else
ma'am.
read it. Is it okay? Yeah. Aarti, would you like to
Somebody
read
else
it?
can try. I'm sorry.
Yes, ma'am.
Go ahead.
Shall I start?
Yeah,
Right
right
after
after
dinner,
dinner.
Abdul went and clenched his chest and told his wife Zenat that he thought he had a heart attack. Zenat wasted no time getting Abdul and their 16-year-old daughter Katrina into the care and raced to a nearby hospital. Although the ER was quite busy, Abdul was placed into a room immediately and attended by Dr. Raghavan and the nurses on duty. After taking the history, the team checked his vital signs, including pulse rate, blood pressure, breathing rate, temperature, and auscultation. All preliminary tests were normal, and Abdul noted that his chest pain had also diminished. I'll be back in a while, Dr. Raghavan said. The nurses also left the room, going outside to take orders from Dr. Raghavan. Zenith held Abdul's hand while he was still lying on examination table. Katrina began to cry. Dad, this is scaring me so much. I don't know what I would do if anything happened to you. I'll be fine, Abdul replied. I'm feeling much better already. I bet they will let me go home very soon. 2 or 3 times during next hour, one of the nurses looked into the room, scanned various instruments and left. Another hour passed, then another. I think they forgot you were here, Zenith said. They know you are fine, or the doctor would be checking on you. I'll find someone and see if they are finished with you now. I'm getting impatient, just sitting here with nothing being done and no one telling us what's going on. Zenith went to the large circular desk in the middle of the room and said a nurse if it was all right for Abdul to leave since They had been in the room for quite some time with nothing much being done. I'll ask Dr. Raghavan, the nurse said. It may be a few minutes. He is with another patient. We might as well leave. He is feeling better, there doesn't seem and there doesn't seem to be a reason to sit around here, said Zenith. When the nurse saw Dr. Raghavan, she asked him, Dr. Rahman's wife just said that they want to go as nothing is being done. So he must be fine. She thinks that she should leave. That is ridiculous, said Dr. Raghavan, almost shouting. So she is bored and she wants to go home. Tell that female that this is not about her and her comfort. It is about the patient. Tell her no. I'm not releasing the patient until we have the blood reports and have completed our monitoring and we are not certain he is not at risk. Katrina, Abdul's daughter, overheard this entire conversation through the conference room door. She went back to the room and said, Mom, it sounds like the doctor is pretty mad at you. Zena said, What for? You are kidding? He thinks you want Dad to go home just because you are tired of sitting here and that you don't seem to care whether Dad is well or not. He told the nurse that they were still monitoring him. They are still monitoring him. How did I know? No one has spoken to us for hours. They just left us in the little room. I'll have a word with the doctor. Just as she spoke, Dr. Raghavan entered the room. Ah,
So this is, there are a couple of case studies given in the reading material. This is one case study I thought we can discuss as patient's expectation. So is this something very usual we see in the hospital setup? But my question to all of you is, should the Rahman family known that Abdul was being, monitored? Yes or no?
No,
Yes.
ma'am.
No. No.
No, he should not have known. Probably my question is not clear to all of you. My question was, should the Rahman family not have known that Rahman is being monitored? Yes. But how would he know? How would he know? Unless the
time to
doctor
time
or the...
update.
Sorry?
With time to time update.
Even once you have examined the patient, whatever you have planned for the patient, for example, you're sending some blood sample to make sure that there is no cardiac condition. So will you not inform the family that, okay, preliminary tests look okay, but then we need to be 100% sure that there is no cardiac condition, and so that we can, set you free and he's under observation. And I'm sure this is a very usual situation that you see in the hospital emergency where the patient is taken in. Initial, everything is done. Not that the care is not provided, but when it comes to communicating with the family, at times we fail. So somebody's device is not on mute mode. Can I request you to put your device on mute mode? Mr. Vimal, your device is not on mute mode. Can you please mute it? Okay. So a lot of time, I'm sure we have seen situations where patient and the family is just not knowing what is happening, what is being done, what is next. And that's where they start, assuming things. Oh, we are being kept just to make money. They are not sending us because they want to charge us for this day or whatever. It may be completely a false assumption, but then because we have not clarified, so naturally they start assuming, and then they start doubting our intention. So my question to you is, why don't we inform or update the family in a proper manner? What could be the reasons? What could be the reasons? Okay, understaffed and overworked. Okay. Assumption bias in what way? Causer, I'll come back to you once everybody has done the answer. Please explain this to me. Yeah. So lack of time. Okay. Overlooking it as not thought important. Very important. Yes. Poor communication skills. Yes. No proper protocol for doctor-patient interaction. Yes. This behavior is normalized because it is assumed that this is the way we function. Okay. Very right. See, when we are getting answers from everybody, we get an idea what people normally think, why people do not, update or interact with the family. This behavior is normal, or there is no proper protocol. And then, any other answer to this, or should we go ahead with the? Okay, so a lot of time not respecting patient's time. You're right, Rose. I think that's also one of the reasons. And communication is not prioritized. Absolutely. So we do everything for the patient, but we don't update the family. As a result, they do not know what is happening and they start assuming, and there's a communication gap. When it comes to not updating the family because of lack of time, very honestly, updating would not take more than 2 to 3 or 5 minutes, but it will save you of a great hassle that can happen later on, isn't it? Because once they know what is happening, what next, what are you planning to do, they are, they would understand what is being done. But a lot of time when you're doing everything and you are not updating the family, it is something like winking at a girl in dark, which she does not know. I repeat, when you don't update the patient's family about what is being done, you're winking at a girl in dark, which she does not know. As a result, the family does not have any idea what is being done. And how did the family's expectation change during their visit to the emergency room? What was the initial expectation? See me, kindly attend to me as early as possible, isn't it? But after that, the next expectation was, please explain to me. And is it unusual to change the expectation? No, but again, we are not used to that. And by the way, what behavior of the physician and the nurse affect the patient and the family? One of you can actually unmute and say, what do you think? What went wrong where they actually became unprofessional in their approach?
They all left the patient's side. There was nobody who was on duty in the patient's room who was supposed to keep them updated with the scheme of things going on.
Absolutely. So nobody updated them. And after that, the nurses came in and went out. But then they still did not connect with the patient's party and they did not explain. So Dr. Purnima, yes, go ahead. Dr. Kausar, I will take you in the next question. Yes, Dr. Purnima, go ahead. Yeah.
Madam, ICUs are busy places, no doubt. And care of the patient, though it was taken care of, all the boxes were ticked. Communication was not given priority because probably they had other things to do on their schedule. And it is often overlooked as something which can be done away with. And they would probably justify it in their mind that they have saved another life or attended another serious patient. So, what if they have not told this particular person what is going on? But however, communication about what is ongoing, at least in an emergency setting and even in other settings, is very important because the patient needs to be in the loop as to what is being done with him or planned for him. Thank you, ma'am.
Absolutely. I agree with you. Thank you. And I think I agree with Mr. Kumar's answer where he has written that there is no proper protocol. I think that's also missing in a lot of hospitals where there's no protocol at all to update the family. I remember I read one, news in the newspaper. It was few years ago. A patient was taken in for angioplasty, and during the procedure they had some complication, and the procedure went on for quite some time. And for next 8 to 12, 10 hours, the family was not updated about the patient's condition. And that came in the newspaper, and then the court actually gave directions that the hospitals and the doctors are supposed to update the family on time-to-time basis, because they need to know what is happening with the patient and how is the patient doing. So you can well imagine that somewhere we don't realize the importance of, explaining to them or engaging them, and especially the kind of practice we have had for decades, where we have actually done paternalistic medicine with patients, where we have always taken decisions on patients' behalf, done whatever we thought was right in the patient's, interest. But the time has changed completely. The patients want to participate, they want to know, they want to understand what are the options. So engaging them, explaining them has become one of the important, expectation from the patient side. So let's go to the presentation that I want to share with all of you, and that's going to help you see what are the common expectations of patients and how do we create satisfaction when it comes to those, expectations. Give me a second to share my screen with all of you. So according to this study by PwC Health Research Institute, after restoration of health, which is of course the first expectation of the patient and the family, it is communication, communication, communication. Of course, after this, they expect timeliness, control and decision-making powers, teamwork in the clinical team, continuity of care, and dignity and privacy for themselves and their families. These are the 7 expectations that have been found primarily among most of the patients, where they expect us to communicate, value their time, engage them in decision making, and they want to see us working as a team. And anywhere if they see that we are not communicating properly with each other or we are not informing each other, they feel unsafe. That if the team is not communicating with each other, and if they are not working like a team, then there's all possibility of some lapses happening in my care, and the continuity of care can get compromised. And then, of course, they expect dignity and privacy for themselves and also for their families. A lot of time, the aggressive reaction that we receive is because of these factors. Of course, we'll be having a complete session on it, and we'll talk about that, at length. So patients expect to be allowed to narrate about their problems in their words and to be heard attentively. On the other side, studies have shown that we interrupt the patient. Any idea within how much time? Within? Yes? You can unmute and speak because it's just one word, so it won't take much time.
First 30 seconds.
11 seconds. This is the latest study. Within 11 seconds, we interrupt the patient. We normally don't allow the patient to speak because we think if we allow them to talk, they will take much longer time. Any idea in how much time can they talk about their problem? Again, guess. You can write in the chat box or you can unmute and speak.
50 seconds.
Actually,
10 seconds.
No, when they talk about their problem, 70% of the patients are able to talk about their problem within 60 to 80 seconds. Of course, there are 15% patients who would really not know what to say. So they may start from something like 10 years ago, what happened, and now they talk about the problem. But most of the patients are able to narrate about their problem within 60 to 80 seconds. And if you give them that 1 minute to talk and you listen to them attentively, they go back very, very happy. And once you do not give them an opportunity to talk about their problem in their own words, I think there can't be a greater agony, because they feel suffocated. They feel they have not been able to talk about their problem in their words. And as a result, there is a lot of dissatisfaction among the patients. Patients also expect to know about their disease in detail. And the studies suggest that almost 45 to 50% of the patients and family, they feel unempowered and unaware of what is actually the patient's diagnosis and the treatment, because they don't get the complete picture. Also, patients expect to be explained in simple and understandable manner. Studies also show that we use a lot of technical jargons. Read this paragraph with me. How many of you could understand? I don't think anybody could, because I was deliberately moving it at a very fast pace. This is what exactly happens with your patients when you explain them about their diagnosis, treatment, or their prognosis. Therefore, it's very important to make sure that when you talk to them, you explain in a manner that they understand. Now, tell me, are these expectations unrealistic or they are new? They are new. So we think they're unrealistic, but none of this expectation is unrealistic. They are new. We are not used to, we are not prepared. We don't know how to handle these expectations. As a result, we feel uncomfortable and frustrated with what they ask. And the consequences of unaddressed expectation. Suppose if you don't meet their expectation, what do you think could be the consequences when their expectations are not met? Would you like to write it in the chat box, or you would like to unmute and speak? I can see some answers in the chat box. Give me a second. So these are old answers, yeah. Consequences would be aggression. Yes, they feel confused, unsatisfied, absolutely. And aggrieved, yes. What more? Losing out on the reputation of the hospital. Yes, definitely. I think the hospital loses, its reputation. They feel hopeless, and strained doctor-patient relationship and lack of trust in hospital. Yes, the patient's loyalty and care is compromised. Absolutely, there's a feeling of helplessness on the patient side. Absolutely. So when you don't address their expectation, when you don't understand their expectations, they may come to you once, but they may not come back to you. They will not send you more patients. So as many of you have already, frustration is another problem. You will see their patients will be dissatisfied. There will be frequent conflict between them and the healthcare providers. Automatically, that will lead to reduced footfall. People can go and write bad reviews for the hospital or for the doctors or the staff, bad reputation in the community, risk of violence and aggressive reactions, and then risk of litigation, which is again becoming a big problem now, and reduced professional satisfaction among staff. See, when we are not enjoying the place where we are working, it leads to a lot of, dissatisfaction, not only among patients, but among the care providers also. So it's very important to see what my patients expect and can we meet those expectations. So this is where I want to introduce you to a very beautiful model offered by Kano. So actually this model offered by Kano was about client's expectation. It was not purely on patient expectation, but this has been modified to understand what my user or stakeholder expects from us. So very beautifully, he says that we can actually classify patients' expectation in 3 categories. One is basic. Then the second one is satisfier, which can actually send the person happy. And the third one is delighters. So delighters are something that would give you, I mean, thoroughly very, very, huge happiness and satisfaction. So let's understand each one of them. For example, if we talk about the basic expectation, these expectations are unspoken expectations, but they are expected to be satisfied. When these expectations are met, they will not come and say you thank you that you have met my expectation. But when these expectations are not met, the client is unhappy. Can you tell me examples of some basic expectations that the patients would have? Can you write in the chat box? Can you write in the chat box? Okay, hygiene and sterile surroundings. Okay, cleanliness, I think I would say. Okay, cleanliness. I mean, they will not come and thank us that thank you, your hospital is clean. But yes, that's a basic thing they will expect. Food. Quality of food should be palatable. Yes, that's what they would expect. Unless it is, yeah. And I mean, they will not again come and thank you. Okay, food was nice. Correct diagnosis. Yes. Quality in care. Clarity of prescription. Courtesy. Eye contact. Housekeeping. I mean, availability of housekeeping services, and then providing appropriate treatment. Yes, correctness of treatment is something that they expect that it would be taken care of. And of course, if that's not being, then being attended to, yes, they come to the hospital that there is somebody who's ready to attend to them, who's ready to, guide them where to go, who will help. Explanation about diagnosis and treatment. Okay, yes, plan. And then explaining care plan on time. Care of patient, yes, that's something very basic they expect. And then explanation of medicines prescription. So these are all very, very simple and basic expectation. And if we are doing it, it's nothing very big. But then if we do this, they will be happy and they will be satisfied. So some of the example is staff paying attention on arrival. So when they come to, for example, to OPD, there should be somebody who attends to them, not that they are waiting, okay, where do I go? Who will listen to me? Who will attend to me? So, or if the patient is admitted, somebody should come and attend to them as soon as possible as they arrive in the, then reasonable waiting time. So they will not come and tell you or thank you, okay, you have a reasonable waiting time. But that's one thing they expect because they want their time to be valued. So if they come to the OPD, if the waiting time is 15 to 20 minutes, they are okay with it. But if it is too short, they are going to be very, very happy. Okay, within 5 minutes, I was attended. Or if it is beyond 15 to 20 minutes, definitely they are going to be very unhappy and dissatisfied with us. Then availability of the doctor. They come to the hospital or OPD, the doctor is available. That's something that they expect. Okay, these are OPD hours. I've been given an appointment. The doctor is supposed to be there, or the person who is supposed to attend to me is available. And when the doctor is attending, or the nurse is attending, or whoever is attending, they ask about what is it or what is the problem. And then if they are being examined by the doctor or the attended by the doctor, they expect the doctor to examine them. So these are all basic, expectation, and if these are met, they are not going to come and say you thank you. But if they are not met, of course they are going to be very, very, very dissatisfied. The second category of patient's expectations are called satisfier or performer. And I will show you that model once again, that table once again. If you are able to meet these, trust me, your patient is going to go very, very happy with whatever you do. So, for example, when these expectations are met, your patients and clients are going to be very happy. But of course, when they are not met, they are going to be dissatisfied. Can you tell me some examples? Can you write some examples in the chat box of satisfier? Timely care. Okay. Was this? No, this is probably in the previous, for the previous question. Okay. Clean and comfortable environment. Yes. Timely care. Being explained about medication. Yes, this is something they'll be very happy, because normally nobody takes extra effort to do that. But when you do it, they go very, very happy. Staff behavior. Yes, completely agree. If that's courteous, well behaved, welcoming, respectful, they are very, very happy. Empathetic staff behavior. Yes, I completely agree with you. Good rapport with their doctor and the team. Yes, again, they are very happy with this. That, I mean, people were very kind and forthcoming. Being told about follow-up date, yes, if they're explained about it. Availability of facilities, if they're explained properly. Explain about their disease and procedure. Yes, that's something that they expect. And if somebody gives them time, they go back very happy. They're very, very happy about it. Availability of facilities, yes. And anything else? Okay. So some of the examples of performers, and if you see the list, that's mainly about our behavior and our interaction with them. Courteous and well-behaved staff is something that they will never forget. They will always remember how did the staff behave with them. Then minimal waiting time. As I said earlier also, patients are very particular about waiting time. There was time we could make them wait for any amount of time. But today they not only feel bad, they don't mind going and writing poor reviews for you for very long waiting time. And then availability of neat and clean waiting area and toilets. Again, these things they expect, and if they are met, they value it. They really recognize that. And then someone attending to the patient's needs promptly. For example, if the patient complains of pain or dizziness or some condition, and the nurse immediately reports it to the doctor, and the resident comes and sees and then escalates the issue, they feel very satisfied that my problem or my concern was promptly attended to, and I was not made to wait unnecessarily. And then while interacting with the healthcare providers, being allowed to narrate your problem. So when you allow them to talk and you listen, if you remember, attentive listening was one of the skill I have mentioned in the essential skills. And that's where it comes in. If you allow them to talk and you listen to them for that 1 minute, they're more than happy with what you're doing. So, and also allowing the patient to ask questions and answering with patience. So this is one thing they want, always some time in the end to ask some questions or to raise their concern. And if you keep that 1 or 2 minutes additional to the consultation, they are going to go back very, very happy. I remember one of my cousin had to undergo hysterosalpingography. So they had visited a couple of gynecologists, and but they were not very satisfied. So she asked me that, can you refer me to somebody? And I have a friend who's a gynecologist. So I said, okay, you can go and meet her. And I called her also, and I told her this is how my cousin is coming to you for her consultation. And this couple, both husband and wife, they actually took lot of doctors' time. And in the end, literally, the husband said, "I'm really sorry, I have asked you so many questions. You must be really, upset with us that we have taken away a lot of your time." And I mean, I was very happy to hear the doctor said, "It's perfectly all right. It's my duty to answer your questions. You have paid me for it, and it's my job to answer you." And the net outcome? Very next day, this patient got her procedure done by. So if you allow them to ask questions, if you answer their questions, I think that's the differentiator between you and any other therapist. And trust me, your patients are not going to do anything. And these are real performance. And if you look at the list that I've shown you, it's more majorly about the communication and behavior. The third category of delighters are called delighters. So when the patient has a requirement but does not expect us to meet that expectation. But if you meet that expectation, they are very, very happy. So This is unexpected requirement turned into a pleasant surprise. Can you share some examples that I have seen now a lot of hospitals doing? It's more like some surprise they want to give to the patient. So do you have some examples? Do you have some examples? Okay, you're writing in the chat box. Okay, special request of food from the kitchen. Yes, I think that's, if the patient says that I'm fasting or I can't take this food, can you arrange something for me? They'll be very happy. Okay, giving water bottle if you when they come to the OPD, very nice. Cost-effective quality care. Okay, 24/7 reassurance to the patient. That means there is somebody to attend to their need. If I'm understanding it right, Priya, if that's what you want to say. And then a hospital in Pune, let me read what it is, has started counseling services for patients, and they're wonderful. I think that's a very good, actually that's the need of the hour, and it actually unburdens the doctors if you have counseling services available in the hospital. Birthday celebration of the patient is very common now. I mean, they would surprise the patient by suddenly bringing a cake and then celebrating the patient's birthday, in case if it falls on the day when the patient is indoors. Then discounts and counseling. Yes, but then, of course, if they expect that yes, we are able to give it. Yeah. In our hospital, catering to Indian population, provide chai and Indian snacks to patients' family. And that's a good idea. I think that's something very interesting, because the families don't expect to be looked after, but if you are able to meet their need, they're very happy and they're very thankful also. Then offering valet parking, I think that's again something that they like, because it reduces their effort and makes it comfortable. Then visitor timings, is it about flexible visitor visiting timings? I don't know if that's what you said. Package discount, get well soon card, flowers, cake cutting on birthday. I think these are again very common, very, very common. So some hospitals, they have now provided free OPD ticket at rupees 20 in my. So is it 20 rupees you are charging or you are not charging, Rose? What it is? You can unmute and say, it's okay. You can unmute and say. Unmute your device. I can't hear you. Either your device is not connected. Charging 20 rupees. Okay. So patients are happy if they're charged 20 rupees? Because it's less, it's not a big amount. So they're happy with it. Okay. Okay. So I've seen a common prayer room, prayer time, prayer song in a hospital at a particular. Yes, that's also people like, because they are in distress, they are overwhelmed, they are anxious. So that plays a very soothing role. Absolutely, I agree. Then giving permission for visitors apart from visiting time. Yes, I think that again, they're very happy and thankful to you for that. So I was telling that a lot of hospitals now, Anju, you may be knowing in US, I think that's a very common practice. After the childbirth, they provide the photographer to come and shoot the newborn and the mother, and a couple of pictures are given complimentary, and if you want the full portfolio, then of course you have to pay. This is another service they have started. I think in India also they have started providing this service for the newborn. They arrange for the photographer, and yes, and they do for baby shower. Okay, I didn't know. I don't know if we are doing it in India. Baby shower, I'm not sure. Then help for insurance. So the idea is that now we are going one step, one extra mile to please our customer. But if I show you the same, okay, these are the examples of the lighters, which actually play a very big role and also is very helpful. So if you remember the personal details of the patient or their family member, they will be very happy. Okay, oh, you are his son. Oh, you are working in airlines. Oh, I know you are working in Indigo. So they will be, oh my goodness, you remember this. So or telephonic follow-up by the hospital staff. This has also become a, a very good practice. At Care Hospital, I know because I was there and I took a session for them. How do you go about doing the follow-up? And during discussion, we found that rather than considering it just the feedback call, I think the follow-up call by the hospital staff and especially by the nurses who have looked after the patient can be a very, very useful service to the patient's family, because once the patient goes home, there will be n number of new challenges that they had not anticipated when they are in the hospital. And if they receive a call from the hospital staff checking for their welfare or asking, is everything all right? Do you need help with anything? Are you able to look after the care or the other things? They will have a lot of questions and they feel so happy about receiving this follow-up call from the hospital. And Care Hospital, they are actually trying to ask their senior nurses to do this calling because they can actually, connect well with the patient party. I think this is something, if any hospital tries, it will definitely create great satisfaction among the patient and their family member, because a lot of times there could be confusion about medicine or follow-up or treatment or dosage, and they may not know whom to talk. And if there's a follow-up call from the hospital side, they will be very, very, very benefited. They'll be very benefited. Yeah. Anju has written there's a special staff to follow up with these patients. Yeah, that's a very nice thing, Anju. I agree with this. But I really like the idea of Care Hospital, because I know a lot of hospitals are calling like more like a feedback call. But when we discussed, I said, call it follow-up call than the feedback call. And this call is given with the idea that, are they okay? Are they comfortable? Do they have any challenges? Do they need any help? I think that is going an extra mile, which is actually genuinely going to help. And then, of course, in case if you need to reschedule the patient's appointment, for example, the doctor is not available, or for some reason your OPD is not functioning on a particular day, informing the patient that, your appointment is being rescheduled so that they save their day and their time. I think they will be very, 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 very thankful to you to have been so kind to inform them beforehand. And then when you are willing to ask and address their unspoken concern, for example, you ask them, I'm liking the food. Is there some change you want to make to food? So you are going an extra mile to find out, are they happy with the services you are providing? And also, and if you're ready to accommodate their request. I think that comes as a delighter. Of course, now a lot of hospitals are trying new and new ways to send their patients satisfied. But if I go back to the Kano model once again, I personally feel if you focus on the satisfiers, they'll give you the best results. You can try delighters, I'm not against it. But if you focus on satisfiers, your patients are going to be very, very. So now when you are designing your hospital services, we have to keep in mind, how do I send my patient satisfied? So at this point, I want to introduce you to a very beautiful concept, something very, very novel, because we are still not there. We are not actually practicing that style of, creating services or product. Please remember, patients' expectations are dynamic. They will change. They're bound to change. Once they are unwell, they just look for restoration of health. Once they are settled, stable, you move them to a room, their expectations are bound to change. They want the bed to be comfortable. They want the room to be clean. They want the toilet to be clean. They want the food on time. They want the doctor to visit them. They want the nurses to listen to them. And these are not wrong. Let's not be unhappy about it. These are dynamic expectations. Those who are able to understand these needs and meet them midway, trust me, your patients are going to go back very, very happy. So at this point, I want to introduce you to a very beautiful concept. This is concept of design thinking. How many of you have heard of design thinking? Write in the chat box yes, if you have heard of design thinking. If you have heard of design thinking, write yes in the chat box. Okay, Pauravi has heard it. I'm glad. Anybody else? Anybody else who has? Okay, Poonam has heard about design thinking. Okay, okay. Anybody else? Okay. So, Pauravi, if I may ask you to unmute your device and tell what exactly you understand by the term design thinking.
Yes, ma'am. Good evening. So, design thinking involves a process of problem solving wherein the person in charge tries to understand the problems in a creative way and provides solution in an interactive way for the person.
Wonderful. I think you have some fair idea about it. Thank you for sharing that. Poonam, you also said that you have heard about it. Can you explain in your words what exactly we mean by design thinking?
All the required things which are required in a hospital, like investigations, x-rays, OPD, they are clubbed together like in a hospital setup, so that patient doesn't have to run here and there. Like if in a maternity ward, if maternity OT, well baby clinic, SNCU are together on the same floor, earlier it was not thought of. Patients were moving from one place to another, and they were finding it difficult to handle the things. Now if you design the infrastructure properly, that is one of the
So,
concerns.
Poonam, although you have explained the application of design thinking, the idea of design thinking is that you are trying to integrate services or create infrastructure that actually enhances or facilitates the functioning of the hospital staff and is also a useful design. But
Yeah, I
actually
meant that.
design thinking is a tool, like Parvi said, that it's a process, it's a tool where you create solutions prioritizing the consumer needs above all. So, design thinking is a program, it's a full-fledged program. If you will Google search, lot of prestigious universities are offering full 1 year, 2 year program on design thinking as a management tool, So, in design thinking, actually, you create services and products keeping the end user in mind. And there are steps to it. So, I am introducing all of you to this concept. Wherever you are functioning, whichever department you are working, if you use this tool in your place of work or a situation, you will actually be able to create, a lot of very useful services for your end user. So if I may talk about some of these organizations, who have created solutions keeping all of us in mind. For example, somebody who thought of Uber or who thought of Amazon. Amazon actually started with books initially. Of course, now they are dealing with anything and everything. But if you talk about Bing and also even today, all their services are keeping the end user in mind. The idea is they want to create service that meets the consumer's need. Not that because I have an idea, I want to do something. No. So similarly, the master trainer program that we have created here is keeping the end user in mind, people who want to do this program and ultimately become trainer. That's the idea about creating that program. So how many of you have seen mothers feeding their babies in the bathroom, especially at the airport or in malls or in public places? I'm sure a lot of us have seen. Of course, not now, because now somebody thought about it and felt that that's not the way, because we don't go and sit in the toilet and eat. So there has to be a proper place for, for a mother to comfortably nurse her child. So there came the idea of, lactation stations. So somebody thought about the end user, mother's comfort, privacy, child's comfort, hygiene, and many other requirements of a mother and the child. And then somebody thought, let's come up with pods where mothers can sit comfortably, feed their child, and have their backs supported, and they don't have to expose themselves in public, and they can, comfortably 5 to 10 minutes spend with their child and feed their child. So I want to introduce you to the idea of design thinking, where we can actually, create services keeping the end user in the mind. So there are actually 5 steps here. I am not going to cover all 5 steps, but I will take you through all 5 steps briefly, and I will take you stage 1, but you can replicate it in your place. So the stage 1 is, first of all, having a deeper understanding of the challenges of the end user. So that is empathize. So somebody saw a lady feeding the child breastfeeding the child in a toilet or in a public place or at the airport, and somebody felt how difficult it is for the lady to sit like this and to breastfeed the child, whereas breastfeeding is such a natural process and it's in need of the child, and the mother has to do it because she wants to feed her child. So when you actually process map with your patient, you will be able to empathize with your patient. So this particular stage I want to take you through, and rest of the things we will discuss after we do the activity. So I'm going to stop sharing and I'm going to take you to a beautiful journey. All of you have a copy and a pen with you? All of you have a copy and a pen with you? Okay. So have you visited your hospital OPD? I'm sure all of you must have seen. But today I'm going to take you to your hospital OPD with a different, in a different way. So imagine yourself, entering your hospital for an appointment, but you are not working there. You are going there as a patient for an appointment with one of the doctors. So we are going as a patient now. You enter the hospital, park the car. So you're in the parking zone. Since you are not a hospital employee, the parking person does not know you. Visualize yourself parking your car. Observe your expectations from the parking attendant. Were your expectations met? If met, say yes, otherwise no. Look at the parking area. How does it appear? Are you happy with the parking area? Is it comfortable? Is it well kept? Is it approachable? Is the ground clean and clear where you're parking your vehicle? And note down the challenges you experience in availing the parking services. Now you have entered the hospital building. You are at the reception. See yourself approaching the reception to confirm your appointment and the doctor's availability. Your appointment is confirmed and you are directed to the waiting area. It will take at least 45 minutes to 1 hour before you can see your doctor, because there are around 4 to 5 patients before you. Reflect on your expectations from the receptionist regarding their interaction with you. Were your expectations met? Yes or no? You can note down from your experience. Now look at the physical setup of the reception and registration counter. Are you satisfied with that? And note down any challenges you experienced in availing the services of the receptionist. You are in the waiting area now. Look around for a place to sit. Are you happy and comfortable waiting for your turn? Reflect on what arrangements would have made you feel better. Are those arrangements present? Observe the waiting area for ventilation, lighting, and seating arrangement. Are they satisfactory? Note down any challenges you experience in the waiting area. Waiting time. Reflect, are you okay with the waiting time? You can note down your thoughts. Your turn comes for consultation. Visualize yourself in the doctor's chamber. You're not working in the same hospital, so you do not know the doctor personally. Reflect on the quality of your interaction with your doctor. Were your expectations met? Note down your observation. Did the doctor attend to you respectfully? Did he listen to you? Did he answer your questions? Did he understand your concerns and address them amicably with patience? Whatever, you can note down whatever thoughts come to your mind. So you have been asked to undergo some blood work. Visualize yourself in the lab. I'm sure you must have visited your hospital lab a lot of time, but now you're going there as a patient. Reflect on your expectations from the lab staff and the services. Were these expectations met? Look at the placement, position, cleanliness, comfort for the patient in the lab. Are you satisfied with the facilities? Also note down the challenges you experienced in availing the lab services. After your lab work, you go to the hospital pharmacy to buy the medicines prescribed by the doctor. Again, focus on your expectations that you have from a good pharmacy and the pharmacist's behavior, the person who's dispensing the medicine. Were these expectations met? Did you have any challenge understanding the medicines, their dosage, and other things? Now, before returning to the car park, you felt like using the restroom. Visualize yourself in the patient's restroom. Check your feelings after using the facility. Get into the car and reflect on your entire visit. Are you satisfied? Segregate your expectations into realistic and unrealistic expectations. Count the total number of met and unmet expectations. Rate your hospital services on a scale of 1 to 10 in terms of fulfilling patients' needs and expectations. And note down all challenges you experienced during your OPD visit. Identify one serious problem area that you would like to focus using the design thinking format. Done. I would ask any two people to share their thoughts. Whoever raises hand first. Kausar had raised hand last time. Kausar, can I request you to share your
Yes, ma'am.
experience of visit?
Yes, ma'am. I think the first part is about the parking. So I would say that uh, I went to the parking lot. I parked. I expected the security guard to smile, perhaps tell me what the rate is if I'm on a two-wheel or if I'm on a four-wheel vehicle. My expectation was cleanliness, green open space.
So,
Limitations
Kausar,
were
rather
that
than giving specific,
they were
Kausar,
not.
rather than giving detailed observation, if you just bring
Yes.
up what was salient, how did you feel, what was an eye-opening, thought that happened to you. It's something like, what do you call that? जब bulb जलता है तो breakthrough, some breakthrough, yeah.
Something.
Or, yeah.
Okay. First and foremost thing was, let's say there was empathy. There was a connection, even though at the parking lot, if we go person-wise, it was welcoming. There were clear signs. Second, I went to the reception area. So I was met by one attendant. The attendant told me that I could have a place to sit, and they would check perhaps if the doctor was available and the appointment had been confirmed. Post that, there was a place where we could pay. If you are an ER and don't know where to pay for the money, or you don't know where to who's the next person you can approach, then there's a may I help you counter, and they allot you one person in the OPD, like a runner who will be with you constantly. Moving that.
Sir, can I stop you here? So, what I
Yes.
want to know from you, could you identify any one area or service that you think requires serious attention and we need to change that? Any one, just one. What was that? Briefly.
Yes, ma'am.
Briefly.
Yes, ma'am. The attendant should know we should be multilingual. That is what I
So
feel.
you felt the language was the challenge.
Especially with the kind of,
Okay.
yes, ma'am. Because medical tourism is coming, so you have all types of patients. So they are there, but they're not necessarily can they cope up with local languages and the foreign languages. So that was one
Great.
short thing.
Thank you. Thank you. Anybody else who would like to tell what was the breakthrough point when you did this empathy?
Patient waiting time.
Okay. So there was a realization the waiting time is very long.
For few.
Okay, great. Anybody else who would like to share their thought process? What was the breakthrough point? Something that you really realized, oh my goodness, the toilet is not okay, the waiting area is not nice, because you have visited your hospital so many times as a hospital, employee or hospital person, that you don't even notice the lacunae in the services and the comfort and the facilities. But when you visit each area, one by one and observe closely, a lot of time you will observe, oh my goodness, the waiting area is very suffocated. It's very, very, it's not poorly, it's not very well maintained. So I want you to give me one point that was a breakthrough point for all of you. I think Poonam raised your hand. You raise your hand. Tell me what it is.
When I went to the doctor's room, I saw that doctor had kept the laptop, printer, computer on the table, and there was no eye contact between the doctor and the patient. I couldn't see the doctor properly, what he was speaking and everything. There was a big barrier between both of us, laptop, and he was continuously on his laptop printing the prescription, which was earlier not there. Now it is too mechanical, and he was just feeding everything in the computer, looking at that, and gave me the electronic prescription. That was the which I didn't felt, like no eye
So
contact,
that means,
no communication, no personal touch,
okay,
no feeling at all was there that we are connected. This was the
great.
major this thing for me.
There was a realization that that needs to be worked on. Thank you. Thank you, Punam. Yes, Dr. Matthews, go ahead. Yeah.
Yeah, I just there's so many points, but two things which I thought is important when I went in. One was the parking is too full, so I thought a valet parking is something which we can introduce in hospitals like malls. Second point is when we go for registration again, overcrowding. I feel self-registration kiosks can be there where you can self-register and go in. So these 2 points, I think,
Wonderful, wonderful. So, I mean, there was a realization that these two things can really,
can be done.
facilitate patients' journey in the hospital. Can be done, and they are doable. They are doable. Wonderful. Thank you. Anybody else who would like to share their breakthrough point or? Okay, but I hope you have understood the concept. You have got the point. So let me take you to the presentation because that was step one. Empathizing is step one to uh, design thinking. The second is then after you have done the process mapping as a patient, now you define the problem. Like for example, uh, Kauser said that she felt the attendant speaks only one language, but we need to have multilingual person at the reception because we receive patients from different background and they may not know the language that the attendant is speaking. Poonam felt that the setup of the doctor's chamber was not appropriate and it did not bring in that kind of warmth and closeness with the doctor, and it felt as though I'm very far from the doctor and the whole thing is happening very mechanically. Or, for example, Dr. Matthews felt that the parking place is very congested and it would take away a lot of time and it will be a lot of inconvenience for the patient's family to make the patient wait and then go and park the car and then bring the patient here. So we could arrange valet parking, and also like we talked about the other facility that is at the registration counter, if we can have kiosks that where people can self-register. So this is after you have done the journey, you have defined or identified the areas that require intervention, that requires modification. After this, the third stage is called ideate. Ideate is where you actually create lot of solutions to the problem. So when we ideate, it is not that we decide one solution and we assume that this solution will work. In ideate, we actually brainstorm. And therefore, in design thinking, we always say, have people from different fraternities, have people from different disciplines, have people from different, professions. Like, for example, hospital industry has been greatly benefited by hotel industry. Since the time they have integrated people from the hotel industry to uplift the appearance and comfort of the patient and the family. Because in both the industries, I think the comfort is primary for the client. So hospital industry is making great use of input from the hospital industry because they come up with lot of ideas that can be utilized even in the hospital sector. So ideate is about creating new ideas. And then when 5, 6 people create ideas, it could be 6 ideas or 10 ideas or 20 ideas. Then collectively, we decide what idea sounds more feasible. So we pick up each idea, and there is actually a concept called create. If you want, you can write down in your diary or copy. It is create. It is an acronym that is CREATE, create. So CR is current reality. So when you empathize, when you did the journey as a patient, process mapping, of the patient's journey. So you actually saw the current reality and you identified the problem. You defined the problem. CR is current reality. EA is explore alternatives. When you explore alternatives, that means ideate. You're creating ideas, you're brainstorming to find solution. EA is explore alternative. So when we explore alternatives, we mine. This is called mining and shining. That means you dig out the ideas. You take out as many ideas as possible. A lot of time they may appear very silly and unuseful or meaningless ideas. Don't stop there. Just create ideas, mining, dig out as many ideas. And then shining. Pick up each idea and do SWOT analysis. Pick up each idea, look for its feasibility. What are the strengths? What are the weaknesses? What opportunities we have? What are the threats? So you do SWOT analysis. Then you will be, able to find a couple of ideas that you think will work. And then we create a prototype. That means before these lactation pod came in, I'm sure in some areas they must have kept these pods initially to see, are the nursing mothers comfortable? Are they using it? Are they finding it helpful? And once they saw that yes, it is very helpful and very useful, now in almost every airport we have these lactation stations. So prototype is that you actually create one solution and then you test it. The next stage is testing, where you implement it in one department. For example, if you think the waiting time is a lot, you come up with a lot of ideas how to reduce the waiting time. And then whatever prototype you come out with, whatever one solution that you come up with, you apply that solution to one particular OPD. Okay, in medical OPD, we will do this. And if you think that's working, then you will generalize it. So after you will test it, you will find out, oh, this is working, this particular thing is not working. So let's fine tune this. So you will further fine tune the solution. And once you're happy, yes, I think this is making sense, you generalize it to the other OPD. So concept of design thinking is a wonderful idea. I think design thinking should be an approach in finding solutions. If you start using it anywhere and everywhere in your workplace, you will be able to, create solutions without any, effort. But you need to have that in approach. So I took you to your hospital OPD. You can visit your individual departments. You could be in lab or pharmacy, anywhere. And you could visualize patient's journey in your department and see, how can I enhance my patient's experience? How can I create more ease? How can I create least resistance or least friction? And if I tell you a couple of examples, I'm sure you must be noticing, and they are actually based on or created on the concept of design thinking. For example, you must have seen these MRI and CT rooms for pediatric population, where they have beautified the interior of the MRI room. The idea is patients, especially children, they become very overwhelmed when they see such huge machines. They're very scared to go for investigation. So if you can create an ambience where the child feels not that overwhelmed or threatened, and I've seen one of the government hospital in Delhi, Chacha Nehru Bal Chikitsalaya, having a lot of the walls and the interior of indoor area, they have painted with cartoon characters, with the idea that children especially, they should feel at home, they should feel comfortable. So that's the idea of making patients stay comfortable. I'm sure the OPDs now are being created with the same concept. Waiting areas are now being created with the same concept, that the patient, it's not only the patient who should be comfortable, even the families and the attendants also should be comfortable, because after all, they spend lot of time in the hospital when the patient is admitted, especially. So the idea is, can we move from thinking that it is an unrealistic expectation to the idea of creating delighters for the patient? So I remember 40 years ago, almost 40 years ago, I'm talking, must be 40 years, 87, 87, 88, I'm talking about. If not 40, maybe 37, 38, 38 years. I had visited Escorts Hospital in Delhi. And when I saw that hospital, I said, what is this? Is this a hospital or a hotel? It looked like a five-star hotel. But after I started, looking at things from the patient's point of view and the family's point of view, I really salute that person who thought of creating those comforts and facilities for the patient and for the family. There was a bookshop, there was a coffee shop, there was a waiting area, there was even, dormitory for the attendants. I mean, I'm talking about 40 years ago. In those days, I don't think any other hospital had that kind of infrastructure. But now, of course, most of the hospitals are trying to create these facilities, these features, because they want to send their patients happy and satisfied. So meeting expectation is like telling them that, yes, we understand you and your needs. So to sum up, let's remember the expectations of patients are definitely about treatment. So they look for effective treatment. But after that, it's communication, respectful treatment, timely care, compassionate care, respecting their privacy, cost-effective care, and high-quality care. I think all of this you had mentioned in your chat when you had talked. If we can, meet these expectations, most of your patients will be not only satisfied and happy, they're going to send you a lot of patients. So this is in nutshell about patients' expectations. Because I know usually we think expectations are bothering and burdening us. But if you will look at it from the patient's point of view, that's the minimum we can offer them. Any questions? Sorry, it's already 10 o'clock again, but we are on time, I can say. So any questions, anything that you want to say, comment? Oh, I'm sorry. So Veera, you are a good, timekeeper and also keeping an eye on this. Thank you. So I forgot to tell about TE in create. I forgot because I continued with the presentation. T is once you have identified the solution that you think appears feasible, and that also collectively you have decided. It's not one person who is deciding. Collectively you have decided. T is tap energy. Tap energy. So whatever you think will work, and all of you collectively kind of worked on it, then give your 200% to make that happen. And that is tap energy. And this is one tool I use often in my various interventions, even in my personal and professional. And you can use it in any sphere of life. This is actually a tool to create solutions. But I find it very helpful because it gives very clear directions from step 1 to step 2 to step. Thank you, Smita, for reminding me. Thank you. Any questions, any feedback, anything somebody wants to? So if no questions, then let me share.
I just wanted to say today it was really nice and interesting and enlightening. Thank you.
Thank you. I think that's the idea of keeping this topic in the session, because I feel we normally think patient expectations are burdening, but I think, as you said, it's very enlightening. It should come as an eye-opener, because we have to look at things from the patient's point of view. Otherwise, our services. And one example of poor designing or poor, this thing, if you have been to the, male members may not have gone, female members, if you have gone to the toilets, even in 5 stars or at the airport, they're very beautifully created those, porta cabins where you can get in and they're very comfortable. There's ventilation, there's, comfort. But look at the size. They don't know that a lot of women wear saris and the door opens inside. When I have to get out, I have to literally touch the pod to get the door open and then go out. And I mean, you have such a huge, wide area outside the toilet or that porta cable. Why can't you have a 4x4 or 4x3, whatever size works? Make a woman go inside with this sari and take turn and see is she comfortable? Are her clothes okay? Not to touch the walls or the toilet seat. That is design thinking. To create solutions, keeping the end user in. It will never fail you. And keep improvising, keep changing, keep improvising. So let me share the feedback form. I'm sharing it in the chat box. I request you to quickly finish it before we go. I hope that's okay with all of you. I've shared the feedback form. I've shared the feedback form in the chat box. I hope it is working. Okay, you want me to WhatsApp it? Yeah, I've added in the WhatsApp group also. Thank you, Rose, for your comment. I'm glad that you like the concept and it's a very useful tool. So I would be happy if you use it in every sphere of your life. Yeah, thank you. Thank you. I think most of you have done it. No, some more to do. Yeah. It take not more than a minute. I request all of you to complete this. So another, announcement I wanted to make to all of us, that in case if there is something like, for example, today was Doctor's Day, if these people had informed me, I could have, changed the date rather than doing it today because 6 of the members have not joined today. We were just 17 of us. I wish I knew it earlier. They informed me only an hour or two ago. If they had just discussed with me, I could have changed the day. Rather than today, we could have done it tomorrow. But I want all of you to attend all these sessions because each session is very thoughtfully curated and picked for the program. And it has a purpose why we are having those topics. But I'll put that in the group also. I'll rather message than those who are not there having message. So if all of you have done, we'll close this session here. If you have any questions, we can always, discuss in the next session. And I will also post what topic we are going to discuss in the next session. Thank you so much for being with me. I thoroughly enjoyed the session with all of you.
Thank you and good night, ma'am.
Thank you. Good night.
Thank you, ma'am.